Alright, so in this video we're going to talk about some of the specific spinal reflexes. Now, spinal reflexes occur without direct involvement of higher brain centers. The brain can still be advised or sort of informed if a spinal reflex is occurring and may also still have an effect on that reflex. For instance, you can actually inhibit reflexes in some regard. Now, testing of somatic reflexes is important clinically to assess the condition of your nervous system. So if someone has an exaggerated reflex or that one that's distorted, absent, or slower, it may indicate degeneration or pathology of specific nervous system regions, whether it's peripheral nerves or even the spinal cord and brain. So more commonly assessed reflexes are those which include stretch, flexor reflexes, and the superficial reflexes. So we're going to first talk about the stretch and tendon reflexes. And these are normally used by our body to smoothly coordinate skeletal muscle. And the nervous system must receive proprioceptor input that tells us about the length of muscle and the amount of tension in that muscle. So the way we get information about length and tension comes from these things called muscle spindles. And a muscle spindle is composed of 3 to 10 modified skeletal muscle fibers that are called intrafusal muscle fibers. These are actually enclosed in a connective tissue capsule within the muscle itself. And central regions of intrafusal muscle fibers lack myofilaments and are non-contractile, but the ends contain actin and myosin so they can contract. So what these are used for then is actually to measure the length and the tension on that muscle. Now, if it's regular effector fibers like the rest of the skeletal muscle, we call them extrafusal muscle fibers. But intrafusal muscle fibers, think about these like the basically like the sensors within a muscle itself. So if you look at a given skeletal muscle here, all of these ones out here will be the extrafusal muscle fibers, right? Now, extrafusal muscle fibers are innervated by alpha motor neurons, and these would just be the normal somatic motor neurons that we've talked about so far. Now, intrafusal muscle fibers are located here within the muscle spindle, and so here we have intrafusal. Remember, the actin and myosin are actually lacking. There's no myofilaments here in the central regions of this muscle, but they are located at the ends. And these intrafusal muscle fibers have different sensory endings. We actually have these primary sensory endings, which are spiraled around the muscle itself, as well as secondary sensory endings that are associated with it. And then these muscle fibers are actually innervated by gamma motor neurons. And these gamma motor neurons actually help to produce some tension on these muscle cells. That way they actually have the same length and tension as the surrounding muscle itself. Now, we also have tendon organs which are nearby too, and we'll talk about the usefulness of these tendon organs with a different type of reflex. So in terms of the functional anatomy of muscle spindles, we see that these spindles are always stretched and excited in two ways. They can either be stretched externally or internally. Externally, we're talking about force that lengthens the entire muscle. Otherwise, internally, gamma motor neurons can stimulate the spindle ends to contract, which stretches the spindle. Now, stretching results in an increase in the rate of impulses to the spinal cord. So if we can measure the number of action potentials that are transmitted by our sensory neuron here, we see that at rest, there's only a given certain frequency of action potentials here that are being transmitted by this this sensory neuron here. Now, while the muscle's being stretched, you see that its action potential frequency increases, and this actually informs our nervous system of the position and length of that given muscle. Now, what's interesting then is that contracting muscle could reduce tension on the muscle spindle. And if that happens, the sensitivity would be lost. Because remember, action potential frequency increases when the muscle's stretched and there's some tension on that. However, if the muscle contracts and that muscle or the intrafusal muscle fibers kind of bunch up, if there's no tension on those cells, then effectively you would lose information about your muscle's position, which wouldn't be good. If you think about how every time you contracted a muscle, if your nervous system lost its information about the length and the tension on that muscle, you wouldn't have very good reflex control. So this situation is avoided because when the muscle spindle is shortened from the gamma motor neurons, they actually simultaneously fire with alpha motor neurons. So we talk about alpha-gamma coactivation that maintains tension on both intrafusal and extrafusal muscle fibers during a muscle contraction. So if you look over here, we're seeing that while the extrafusal muscle fibers are contracting, if the intrafusal muscle fibers didn't correspondingly contract, you would lose information from these intrafusal muscle fibers because they wouldn't send action potentials back toward your spinal cord. So to prevent this, we get alpha-gamma coactivation. so that our alpha motor neurons that innervate the extrafusal muscle fibers cause contraction here. Simultaneously, when the gamma motor neurons fire with these intrafusal muscle fibers, it maintains the same amount of tension, or at least close, so that way we can still get some action potential information that's being sent back to the spinal cord that can inform our spinal cord and brain of your muscle's current position or state. So one type of reflex we'll talk about here is a stretch reflex. Now the stretch reflex is also called the knee jerk reflex. It's basically a reflex that keeps the knees from buckling when you stand upright. Now the stretch reflex maintains muscle tone and large postural muscles and adjusts it in a reflexive way. Now it causes muscle contraction on the side of the spine in response to increased muscle length. So if we look at an example here, we see that when a muscle is stretched here, we see impulses that are being sent back toward your spinal cord through a sensory neuron. That actually causes excitation of the corresponding motor neuron that muscle innervates directly. It inhibits the antagonistic muscle. And the purpose of this is to prevent overstretch of the muscle, so that while the muscle is being stretched, if you can cause it to also contract, then you can prevent that muscle from being stretched too much and prevent damage to the muscle itself. But in order to have this muscle contract, you got to inhibit the antagonistic muscle on the opposite side. So you see, as a consequence of this reflex, you can excite the motor neuron that connects to the same muscle, and you can inhibit the motor neuron that goes to the antagonist. That way your muscle can stretch. And an example where this occurs is the patellar tendon or knee jerk reflex. So what we see here is if you tap the patellar tendon and your muscle is stretched as a result, right? You're tapping on the tendon that associates with this muscle. Muscle stretches. Now to prevent damage to that muscle, and once that stretch information is picked up by your muscle spindle, information and action potentials are sent back towards the spinal cord, where this sensory neuron then connects with motor neuron that goes to the same muscle that was stretched. It causes that muscle to contract, which has a tendency to want to draw your leg outward in an extension kind of manner. Now, in order for this to occur, we also need to inhibit the antagonistic muscle. This is actually done by exciting an inhibitory interneuron. This inhibitory interneuron actually inhibits the motor neuron that connects to the antagonists here on the hamstrings. That way your leg actually kicks out. So what you're doing when you're testing the patellar tendon reflex is just to see if this muscle spindle is able to work how it should to protect your muscles from damage. Now, tendon reflexes also involve polysynaptic reflexes, and it helps prevent damage due to excessive stretch. It's important for smooth muscle onset and termination of muscle contraction as well. And so an example of where we see this happening is where we see stretch of our tendon here. And in response to this, we actually have impulses that are sent back towards the spinal cord. And to prevent overstretch on that tendon, what happens is that our sensory neuron excites an interneuron that inhibits the motor neuron that connects to the quadriceps. That way, once the tendon is stretched too much, you can actually inhibit this muscle from contracting any further to prevent overstretch. And then to also prevent this and reverse the stretch, what we can do is actually excite an interneuron that excites the antagonistic motor neuron that has your hamstrings contract. That way you can prevent overstretch on this tendon. So another example of reflex is the flexor withdrawal reflex. And withdrawal reflexes are initiated by painful stimulus. And this actually causes automatic withdrawal of a threatened body part. These are ipsilateral, so they occur on the same side of your body, and they're polysynaptic because there's often many muscles that are involved. It's protective in the sense that in response to pain, you can lift an entire limb up, and therefore important for your survival. Now, your brain can override this if you need to. So for instance, if you know your finger is going to get stuck with a needle for a blood test, you can prevent the reflex from happening. So crossed extensor reflex occurs when flexor reflexes and weight-bearing limbs are used to maintain balance. So it consists of ipsilateral withdrawal and contralateral extension. And what's cool is actually this is one of the ways that our legs are able to walk, and we can maintain our balance through a reflex manner. So it's stimulated with one side withdrawn, and the contralateral side will actually extend. Now, examples of this would be like stepping barefoot on broken glass can cause your damaged leg to withdraw from the painful stimulus. And so in order to maintain your posture and balance, the opposite leg will extend. That way you can maintain your body in its upright position. So you can shift your weight. Now, someone grabbing your arm can also cause the same reflex to happen. So we'll see that example here. So you might have someone grab your arm, and in response to this sort of noxious stimulus here of someone grabbing your arm, sensory information sent back towards the spinal cord by this primary sensory neuron. It synapses on an interneuron here that has 3 branches. 2 branches go to the ipsilateral side, the same side, right? Now, one of those inhibits the extensor muscles of your arm, and the other one excites the flexor muscles of your arm. That way your arm flexes in response to this noxious stimulus. And the purpose of this would be to withdraw from the stimulus itself. Now, correspondingly, because of this other branch that crosses to the opposite side, contralaterally, we get inhibition of the flexor muscles and excitation of the extensor muscles that then causes our other arm to extend. If you can imagine this occurring on your legs, what if this was your foot that stepped on a piece of glass? Well, the foot that stepped on the glass could flex in response to a reflex, and simultaneously, because of contralateral inhibition excitation, your other leg could extend to help bear its weight on this leg. And it does this by inhibiting the flexors and exciting the extensors. That way you can maintain your body position and shift your weight to the opposite leg so your other leg could withdraw from that painful stimulus. And what's pretty cool is a lot of our walking ability maintains or sort of relies on these types of reflexes, which we call central pattern generators. And these actually exist in the spinal cord to help us walk. And so a lot of walking is actually a reflex pathway. So in terms of developmental aspects of their peripheral nervous system, we know that spinal nerves branch from developing spinal cord and neural crest cells. They actually exit the vertebral foramen and basically supply motor and sensory fibers to developing muscles prior to their maturation. Cranial nerves also innervate muscles and structures of the head. And distribution of growth of spinal nerves correlate with the segmented body plan. So with age, sensory receptors atrophy, muscle tone decreases in the face and neck, and reflexes can slow. And this is due to a decrease in number of synapses per neuron, so we see slower central processing. Now, peripheral nerves are viable throughout life unless they're subjected to trauma.